has worsened drastically, with the AQI hitting 480, placing it in the hazardous category. Compared to other global capitals, Delhi's pollution is alarmingly high, with residents facing serious health risks and authorities urging people to stay indoors, wear masks and limit outdoor activities. Let's in fact compare this AQI with the capitals all over the world. So now, of course, viewers, let me show you these images here. Now, of course, there's an AQI crisis that you can see, India versus world capitals. Now, New Delhi is at a 491. So that, of course, viewers, on your screen, as you can see, and Washington is at a 35. So that, of course, viewers, look at the difference. And then New Delhi is at 491. Beijing is again in China at 35. Then we're getting New Delhi at 491 and Moscow, Russia at 32. And then, of course, we have New Delhi at 491 and London, UK at 59. New Delhi is at a 491 and Tokyo, Japan is at 19. And New Delhi is at 491, while Berlin in Germany is at 24. New Delhi is at a 491 and Paris is at 52. And New Delhi, of course, is at 491 and Canberra in Australia is at 35. New Delhi is at 491, while Wellington, New Zealand is at 32. New Delhi is at a 491, while Stockholm, Sweden is at 13. New Delhi is at a 491, while Riyadh, Saudi Arabia is at a 92. So that, of course, viewers, are the details that we're sharing with you of, we're doing a comparison of the different AQIs with different parts of the world and Delhi. And now, of course, I have Dr. Arunachala, MM, of course, from Yatharth Hospital, who's a pulmonologist. He's a lung specialist joining me. Now, doctor, I want to begin by asking you, what is the kind of impact that these kind of pollution levels that we're experiencing in Delhi have on the lungs of people?
Yeah, exactly. I think this is the worst time. I would like to say that in the recent 4 to 5 years, it's been a new normal that what is considered post Diwali and post every time in the winter sets in, we face a very bad hazardous air quality in north zone, mostly around the Delhi NCR. And what exactly is this is we thought it's just a concern of air quality, but it is not so because it can affect us each and every organ, right from our eyes. We used to have congestion, redness, and we used to have some irritating sensation, and skin also we have some itching as well. Apart from that, the most common organ involved is the lungs, which causes most common bronchitis. And because of this poor air quality, the suspended viruses and bacterial infections also stays for a longer period of time, so that the infectivity gets higher. And patients who are already suffering from bronchial asthma or COPD as well are chances of very high prone to get a new exacerbation and worsening. And their ICU admission rates is also increased in the recent times. And this can also cause a heart event such as ischemic heart disease as well. And memory losses and cognitive impairment is also at a chance of high risk. And recent studies which have said that it can even increase the chances of getting diabetes because of this. So these are all the impact, and even lung cancer risk is increased because of this. I think we all would be aware with the latest study which has been published that almost we are losing 8 years of our livelihood because of this poor air quality compared to the WHO standards.
Doctor, now at this time, especially for the elderly and children, what are the kind of precautions that a person can take to protect their lungs and their heart?
Yeah, exactly. I think the first point is if somebody can able to afford to stay out of the country, stay out of the state at least for next 4 to 8 weeks, that is best. But that is not possible in 99.99% of our population. So the best tips what we need to follow is we need to hydrate adequately among us. And second thing, we should avoid eating any exercises or outdoor activity. We should stay indoor. Third thing is the personal protective measures such as mask. Mainly N95 only works against PM 2.5 or PM 10, and simple surgical mask doesn't help it in that way. So it is advisable to wear N95 in a proper way, and good seal should be maintained. Third thing, protection at your office spaces or at the homes will be the air purifier, but it is costly. It is not a solution to that. I know that. But whatever the best way, what we are having right now is the air purifier with a good HEPA filter. And that also is not like that we are getting it up and putting it on elsewhere. We need to keep the door shut, and whenever doors open, it takes some time to again get back to lower time. We need to have a proper servicing of that. That is also important. And the final point is this is the season of winters, festivals, at the same time season of viral infections. So I would suggest along with this air poor quality, chances of getting respiratory infections is very high. So getting vaccinated against the common infections such as influenza and pneumococcal is very much advisable.
And doctor, if I talk to you about the kind of diet, the kind of exercises that a person should follow, should a person do rigorous exercise or how should a person go about it?
Rigorous exercise outdoors is completely strictly banned because tending yourself to get more harm by doing a vigorous exercises outdoor. So indoor exercises is advised, and you try to do workout indoors only, and you should hydrate adequately. That is very much important at this point of time because we don't sweat. It is not summer time. We usually tend to have less amount of water intake, but that is not good.